Hello and welcome. You're watching Arirang TV's special coverage of the COVID-19 pandemic. I'm Min Son-hee. Korea's triage centers, the temporary facilities that were set up to care for those with mild symptoms of COVID-19, are poised to close doors tomorrow. Now, these triage centers, totaling 15 across the country, played an instrumental role in the fight against the virus here in Korea, and we have details in the latter half of the program. First, here are the headlines with our Kwon So-ah and Noah Ram. Welcome.
Hi.
Hello.
So I will start with you with the domestic updates. I understand the government is calling for caution among members of the public to prevent cluster infections.
Right, and that as we're just ahead of the golden holiday, of course, and we will probably hear more of that in our later afternoon briefing. But also earlier in the day, Vice Health Minister Kim Gang-nip stressed that carelessness should not become a reason for new infections during the almost 1 week holiday. Kim noted that many Koreans do have travel plans, that is, or other occasions to gather with people, which is causing concerns of a new spread in coronavirus infections between April 30th and May 5th, as people are expected to have more contact with others. And that's why he said the government is focusing on reviewing quarantine measures for the holiday, and that the tourism ministry is providing guidelines for traveling on its website regarding various means of transportation, rest areas, and accommodation facilities. Speaking of facilities, data showed around 97% of accommodations such as hotels and resorts in popular tourist cities like Sokcho and Gangneung in Gangwon-do province have already been booked, and a similar situation in Jeju-do Island with many flights and hotels fully booked, and where some 180,000 people are expected to visit. And now let's move over to our daily updates. We have 9 new cases, a slight drop from yesterday, but 2 more deaths. And the number of people that recovered from the condition is approaching 9,000. And moving over to our map, we have 3 new cases in Daegu, 2 in Gyeonggi-do province, and 1 in Chungcheongnam-do province. And we have no new additional case in Seoul, where now the total number of infections stands at 633. 5 are imported cases and 4 are domestic cases, and 3 have been detected at airport screenings. Now, we also have concerns of COVID-19 infections, not only from abroad, but also there are growing concerns that unregistered foreigners here in the country may not have the chance to get masks or even not get the chance to get tested for the virus. And that concern has been mentioned by Prime Minister Chung Se-kyun earlier in the day to call on officials to take measures.
Right, so over on the global front, the UK is on track to become one of the worst hit countries in Europe when it comes to the death toll. But first, a state of emergency has been extended in Egypt.
Yes, that decision was made on Tuesday local time, as the country recorded the highest daily death toll as well as new infections. Egypt's President Abdel Fattah el-Sisi renewed a state of emergency across the nation, citing health and security concerns. The 3-month extension is part of a long-running state of emergency that's in effect since April 2017, when dozens of people were killed in twin church bombings by Islamic State-affiliated terrorists. The state of emergency gives the president rights to suspend schools and public sector work, as well as quarantine travelers. The country has been closing airports and implementing night curfews to contain the spread. Meanwhile, on Tuesday, Egypt recorded the highest number of new cases with 260 infections and 22 deaths, which is also a record high. And accumulated cases have surpassed 5,000, with at least 359 deaths, while some 1,300 have recovered. And now let's move over to the UK. Just after Prime Minister Boris Johnson's recent remarks of a successful dealing of the pandemic, data published on Tuesday showed that fatalities from all causes in England have reached more than 21,000 by April 17th. And this number being significant, as the week ending on that day is now the deadliest week on record since such figures were compiled in 1993. So no doubt due to the effects of COVID-19. And combined with numbers from Scotland, Wales, and Northern Ireland, Ireland. The total death toll in the UK stood at over 24,000 as of April 19th. Now, when it comes to the official number of COVID-19 deaths, the UK now has more than 161,000 with 21,678 deaths. The UK has, meanwhile, decided to now count deaths occurring outside of hospitals too, so the tally is likely to rise even further. The US death toll approaching 60,000, and Italy now has more than 200,000 cases, just like Spain, and Russia has surpassed Iran with total infections. And those are the latest figures.
All right, Sua, thank you for that. We'll come back to you later on after the briefing. Aram, the long holiday, it's upon us now, and authorities here are concerned or worried about a possible surge in infections.
That's right. So I did mention it in her report, but just to go into a little bit more detail, we do have Buddha's birthday on Thursday, we have May Day or Labour Day on Friday, and of course Children's Day on May 5th, which is next Tuesday, and authorities will be keeping a watchful eye on the situation in the upcoming holidays and are also urging the public for vigilance and caution. No doubt, officials are advising that citizens get medical treatment as soon as they feel any symptoms, no matter how minor they may be. They are also advising against going to places that tend to be crowded, such as Jeju and Busan, but as we heard from Soa, it appears to be a bit too late because bookings are pretty much full at the moment. Jeju, for example, will have medical staff stationed at the airport to screen possible cases. They are bracing for an influx of travellers. Special test facilities have also been set up there, and many travellers to Jeju often rent cars as they go, and those that do have to sign a pledge that mandates the wearing of masks while they're driving and also the logging of their travel routes while they use the vehicles. And the public is also, of course, being advised to keep strict hygiene routines such as washing your hands regularly, wearing your face masks and keeping safe distances from one another.
Of course. Diplomatic efforts continue to fight the pandemic. I understand the leaders of Korea and Austria spoke over the phone. What was said?
Well, according to a tweet by the Austrian Chancellor Sebastian Kurz, both countries agreed on the need to cooperate internationally to avoid a second wave of infections. The Chancellor added that Austria followed a similar approach to South Korea in the fight against the virus. Neighbouring Germany has also benchmarked Korea's tactics in the fight as well. Kurz also noted that Seoul has been successful in the fight through decisive and early measures. The Blue House also said the two leaders discussed other bilateral issues, including a push to resume direct flights between the two nations, because a lot of flight routes have been closed down because of the virus.
Right. Aram, sales of air purifiers had surged on the belief that they might help prevent the spread of COVID-19, but a new study shows this is not the case.
That's right. Researchers at the Kacheon University Kill Hospital claim the use of air purifiers indoors may actually increase the spread of the virus. Now, in their study, the researchers noted that the speed of the fan pushing filtered air out is stronger than the internal fans used to pull unfiltered air in, which is usually located at the bottom of the appliance. Now, this means that if the device was put on the floor, for example, and someone coughed or sneezed, those droplets that would fall to the ground will be blown back up because of the strong fans at the top of this air purifier. And therefore, the researchers have come to the conclusion that air purifiers will do more harm than good when trying to prevent the spread of COVID-19. They are also expressing concern over the use of air purifiers in confined workspaces, such as offices, as there tends to be more of these air purifiers in a confined space running for hours on end, and there are also more people there, so the more likelihood of coughing and sneezing. As for the effectiveness of air filters filtering out the virus, the researchers say commercial air purifiers are focused on pollutants and not really the virus itself, so they are proven not to be that effective in filtering out the virus.
I see. All right, Aram, thank you for that. It's a little after 2 in the afternoon here in Korea, and we are poised to join the Central Disaster and Safety Countermeasure Headquarters for the regular afternoon briefing. We'll be back afterwards. Well, it seems that the briefing has yet to start, so while we wait for them, as we've been reporting, despite the daily number of new cases hovering in the teens and below, authorities remain concerned over the possibility of cluster infections ahead of the start of the so-called golden holiday, golden weekend, starting from tomorrow. Some 180,000 travellers are expected to head to the southern resort island of Jeju, as our Soa mentioned, and the health authorities there have announced intentions to ban the entry of travellers showing high signs of fever fever, that is. Meanwhile, the efforts, that is, to curb the spread of virus among undocumented immigrant workers have government authorities here pledging to ensure that some 380,000 of them will be able to receive the medical healthcare attention without fear of being deported. Here now is the briefing.
Let us now begin our regular briefing on the coronavirus outbreak here in South Korea. As of April 29th, today, the total number stands at 10,761. This includes 1,061 imported cases from overseas, and of the total, 82.9% or 8,922 have been discharged following full recovery. Yesterday, we had 9 more cases, and 68 more people have been discharged following full recovery. And out of the 9 newly confirmed cases, there were 5 imported cases and 4 have been reported on through domestic infection. Looking at the sources of infection for the past 2 weeks, most of them were imported cases, and also 11.2% were related to cluster infections at nursing hospitals, and 13.5% were related to religious regional circles. And also we have unidentified sources of infections, and those are under investigation. We had 5 imported cases. 2 were from Europe, 1 from the Americas, and 1 from China, and another from Japan. And out of the newly confirmed cases, we had in the Yeongnam University Hospital in Daegu. This is a hospital dedicated for COVID-19 cases, and 2 medical workers working there have been tested positive. And also 1 person who has been dispatched to the site after this person was on the monitoring period. This person tested positive, and while we had the investigation on all of the members there, we also have 1 person testing positive, and we are currently carrying out contact tracing there. The KCDC has confirmed that as of today, we confirmed that more than 500 people, children and teens, have been confirmed. And from the 10,761, these people account for about 14%. And by age, we have 0 to 6 as standing at 81.5, and 7 to 12 accounting for 21%. And 13 to 18 accounting for another 50%. So a majority of them were in this age bracket. And looking at the regional cluster infections, Daegu, we had also most of the cases, and 42 were in Seoul, and also followed by Gyeonggi-do province. In Jeonnam and Jeonbuk, we did not have any children infections. And out of these children infections, there were no fatality or critical cases, and accounting for 82%, they have been discharged after a full recovery. And the sources of infection for most of them were related to Shincheonji Church, and accounting for about 40%, totaling to more than 200, and also 107, or about 20%, were related to the contacts, and also it was followed by imported cases, and 66 of them, which is 13% of the total, were related to the regional cluster infections. And so far, those who have been tested positive after the discharging have been accounting for 17 of the total, and which is about 13% of the infectious rate. And out of the 91 children, 20 had no symptoms, and the symptoms that they had was coughing and sore throat and mucus. And the KCDC, we have identified that the children and the juveniles are going through depression and nervousness through COVID-19, and we have seen an increase of psychological consultations, and we believe that the trauma is being a big issue for these people. And we would like to advise to give them appropriate information so that they do not get anxious over the disease. And as for the 7-year-olds, we have found that a majority of them were scared of the virus. And when looking at the middle and high school students, many of them said as they were they're not being able to go to school, they were very depressed and they were very upset about the situation overall. And as for foreign countries, other countries also report similar symptoms, and 1 out of every 5 kids have depression. And the KCDC, we believe that we need to protect and secure our children and ensure them a safe environment. And this calls for the efforts by the adults. And the personal hygiene measures that can be implemented by children should be notified to them. And these include washing of your hands, and second is wearing of the face masks. And these measures can be some preventive measures against the virus need to be delivered to these kids. And also, they need to be educated that they should not discriminate any COVID-19 patients. And we need to provide them with positive messages and positive words so that they have a stable mental state. Starting from tomorrow, we will have a long week, holiday week, and we believe that we will see an increase of people on the moves. And if you have any symptoms or fever, please refrain from traveling, and please travel on your vehicles with family units. And even during your schedules of travel, be sure to wash your hands thoroughly and wear your face mask and cover your cough, and keep at least 2 meters from other people. And please wear a face mask if you are visiting indoor public venues that are crowded. And after your travels, if you have any symptoms of a fever or respiratory symptoms, please stay home and get some rest. And if you experience prolonged fever or severe symptoms, you should call the KCDC call center or get screening testings.
Right, and that was the government's afternoon briefing, and I have Soa here to give us a summary of the key announcements.
Yes, that was the last briefing before the long holiday, which starts tomorrow. What usually would be a time where we would get excited for travel or taking a good rest. But I think the atmosphere is pretty subdued this time, but still people are planning to travel, and that's why the KCDC chief said that we should travel in our own vehicles if we can, and also wear face masks at public facilities. And if we do see symptoms, people should stay at home and take a rest. And now what's a little special at this briefing, we didn't see the entire briefing with a question and answer session, but children were said to have questions to the health officials. And it looks like today's briefing was focused on those younger people. In fact, out of the total coronavirus cases here in Korea, it looks like 4.7% out of the total were people below the age of 18. But fortunately, here in Korea, we did not have any deaths or people that were severely ill in that age group. But what's also a concern is that little children can develop depression or anxiety because of the coronavirus, especially as their routine has changed. They can't go to school, and that's why our research showed that 7-year-olds, more than half of them said they are actually scared of the virus. And the KCDC chief also mentioned that hygiene measures and the parents should make sure that children are aware of these hygiene measures and also wear face masks and wash their hands, and also do not discriminate people that were patients who had the coronavirus.
All right, so thank you for that. We'll see you back on Friday, I think.
Yes, see you.
입원 상태의 의학적 치료가 필요 없는 90% 정도의 경증 환자는 생활치료센터에 들어가 의료진이 상시적으로 모니터링하며 보호하고 있습니다.
Providing medical assistance to a large number of patients while keeping them in relative isolation is a daunting task, one that is currently being faced by health professionals across the world amid the COVID-19 pandemic. Korea now was no exception in the early stages of the response to the virus, but we were able to ease that burden by setting up a number of triage care centers for those with mild symptoms and thus freeing up limited hospital beds for those requiring intensive care. To learn more about this strategic initiative, I have Dr. Yu Byung-wook from the Suncheon University Hospital. Welcome, Dr. Yu. And I have freelance journalist Rafael Rashid. Good to see you again, Rafael.
Hello.
We'll start with you, Dr. Yu. The global number of COVID-19 cases has topped the 3 million mark, but Korea in recent days has seen its number hover in the teens and below. Are we safe now?
Oh, I like to say safe, but I don't want to say safe because government said less than 50 cases confirmed and less than 5% of the cases can be tracking and tracing. That time we are safe. But this day, around number, yesterday was 14, today is 9 confirmed cases, but still the Gyeonggi-do Pocheon and Gyeongsang-bukdo Yecheon, there are some cases we cannot tracing and tracking yet. So which means that's why we are worried about this is long holidays. So the people are moved from over there, the Gangwon province and the Busan and Jeju, all over there, the kind of mixed. We can be happening again like the middle of February, like Daegu Gyeonggi province again. So we are safe now, but I don't want to say safe 100% now.
I see. Because of these cases of the virus that have no sources, or we are not unable to trace the source, that is.
We would like to tracing so where it came from, but still some cases we don't know where it came from.
Right, I see. Rafael, British Prime Minister Boris Johnson has returned to 10 Downing Street after having recovered from COVID-19. Tell us a bit about the situation in the UK and the rest of Europe, please.
Well, I think in the UK, the situation, authorities say it's under control, but it's still a little bit too early to know whether or not it's slowing down. In the UK, the peak of coronavirus infections has apparently been reached, and last week, Matt Hancock, the health secretary, announced that the UK had reached the peak of the outbreak, and experts are also saying that the curve has broadly flattened, as have hospital deaths. But as we saw earlier on in the program, the official count has not so far taken into account death in, say, care homes. So I think we have to be very careful about, we should be carefully optimistic about whether or not the curve has been flattening or not. And right now in the UK, there is rising pressure for the government to reveal plans about whether or not it will ease the lockdown and if and when it will.
Right. Dr. Yu, you touched upon Korea's triage centers the last time you were here. Would like to focus on that today. Perhaps you could start with what they are and how they work.
Well, Triage Care Center, this is the first time we present and suggest in the world, but it's happening because of chaos from the necessity in the Daegu Gyeonggi province. So one sample, if you are young, so we are young, but if we catch it and confirm, we are so afraid about it. So everybody wants to rush to go to the hospital. But the hospital, there are some priorities, people, but who can confirm it? So who can say who was most seriously ill or who is mildly ill? So that's why the jamming, we had a little bit, but some cases cannot reach the hospital and service. That's why we can turn into some government officials, human resource capacity center, and also the dormitory in the university turn into the mild ill cases can be observed under the doctors and the nurses' hands. We can detect who are going to quickly to the serious ill. We transfer the hospital. But the cases who are confirmed positive, who need the quarantines, but nobody knows who get worse quickly. That time, the triage care center work is like the purpose to the rush to come hospital, but also triage is distributing the cases of patients.
Oh, I see. Raphael, what was your response to the fundamental concept of these triage centers when you first heard about them?
Yeah, I was extremely impressed by this kind of new concept because it offers kind of middle grounds between being in self-isolation at home and being hospitalized. And of course, many people would have wanted to go to hospital if they have coronavirus symptoms, but we need to reserve those special beds for people who actually need intensive care. So I think it was a fantastic idea of authorities to roll this out. And you know, the government was using empty facilities, you know, such as training centers or even university dormitories. So these spaces were there, we could use them, and I think they made very good use in order to contain the virus.
Right. Now, like Doctor, you mentioned these triage centers became a necessity here in Korea following an overwhelming surge in infections in the southeastern city of Daegu and the North Gyeongsang province. In this next video, we meet a city government official in Daegu for more on how these triage centers were founded.
The city of Daegu in Korea's southeastern region became home to the world's first triage care center for mildly ill COVID-19 patients.
지난 2월 17일까지만 하더라도 우리나라 전국적으로 환자분들이 한 30명 미만이었습니다. 하지만 2월 18일 날 31번 확진 환자가 대구에 발생을 했고 이 환자가 종교 생활을 통해서 집단 감염으로 급속히 확산됐습니다. 그러다 보니까 초기에 이러한 확진 환자들을 입원시킬 수 있는 병상과 병동이 부족했습니다. 그래서 이러한 부분들의 그 안타까운 그 사정으로 인해서 확진 환자가 제때 치료를 받지 못하고 검사를 받은 뒤에 집으로 돌아가고 난 이후에 안타깝게 사망하는 사고도 있었습니다.
The triage centers operate 24 hours a day, providing care and treatment, which even includes psychiatric services. However, many hurdles had to be overcome before they first became operational, such as budget issues and securing cooperation from the private sector.
치료센터를 구축할 당시에 3,000명 이상의 환자들이 급증했기 때문에 하루에 1개 센터씩 매일매일 15개 센터를 구축하는 굉장히 급박한 일정의 작업이었습니다. 생활치료센터에 대해서는 기본적인 운영 지침과 또 예산은 국비로 한다는 기본 원칙은 있었지만 세부적인 매뉴얼도 없었고 또 예산이 확보된 상태가 아니었습니다.
The triage care centers and their medical staff played a pivotal role in curbing the COVID-19 outbreak in South Korea.
대구시 공무원을 비롯해서 보건복지부, 행안부, 중앙부처 공무원뿐만 아니라 의료진, 그리고 소방관, 심리상담가, 경찰서, 그리고 민간 용역업체, 그리고 군인분들 이러한 부분들이 함께 소통하고 협업을 하면서 생활치료센터에 입소한 분들이 모두 건강하게 퇴소할 수 있도록 도운 거죠. 그래서 현재 기준으로 하면 한 2,800명 정도의 경증 환자분들이 건강하게 다 퇴소를 했습니다. 그래서 이러한 부분에 창의적이고 또 적극적인 생활치료센터의 도입으로 인해서 코로나19의 급증한 큰 불을 조기에 우리가 진화할 수 있었다 이렇게 판단이 됩니다.
Doctor Yu, I understand these triage centers are different from the regular, fully equipped conventional medical facilities. Tell us a bit more about the differences.
Well, he commented it was just kind of just dormitory or empty facilities run by governments, but we have to turn into as like a hospital-like. But as you know, there are many different services like intensive care units and outpatients and the service area for the screening. But usually the patients who are recovered, we are staying just at bed and they're taken care of by the nurses and doctors and the surroundings. So we have an idea, got it? Oh, because most of the people with the COVID-19, no symptoms, but who have a positive, but nobody knows who get worse quickly. So let's get to the inside some facility and control from the people who are safe. So there are two regions, monitoring closely and the catchings who are seriously returning too soon, sent to the facility in intensive care units. But at the same time, we can refrain the people are keep from the other person non-infected. It's both. We can control it. Same time, actually, it's not a hospital. There are no medical equipment, but doctors, nurses, and officers, they were monitoring for 24 hours, like a group in facilities. I believe if we don't have the triage center in Korea, probably there are more victims that happens.
I see. So it's a place where you can monitor the people and also isolate them. Doctor, you setting up these triage centers, I'm assuming it was an expensive endeavor. Were there any donations or assistance of any sorts from the private sector?
I was happy to having the notice from the LG, Samsung, Hyundai Car Motors, and as well the Gyeongbok universities, and many there are the facility they donated open soon because it was kind of urgent requirement from the Daegu Gyeongbok province. And the big size of enterprise company, not only this, and the middle-sized company as well, today because of the soap, brush teeth, and the towels, and the papers, they provided and for free as well. So not only the big size, small, middle-sized enterprises, they donate for this facility to operate it.
So these conglomerates were donating their dormitories, is it? Or?
Yeah, they give you all the triage care center because they need some kind of consumes the things like the soap and the toothpastes. The basic things also provided from the small middle-sized company too.
I see. Raphael, is there a similar initiative overseas?
As I know, there aren't necessarily such systemized approaches in other countries, although many countries are running certain forms of these kind of centers. So as the coronavirus spreads, obviously tourism has come to a halt and thousands, hundreds of thousands of hotel rooms have become free. So in cities across the US, hotels are being used to quarantine people who might not be able to self-isolate or socially distance themselves at home. And hotels are also being used in Spain, Israel, Australia, and many other countries. So it's similar, but not quite as systemized, I believe. And I think even in Egypt, confirmed cases that are deemed clinically stable, so do not need too much care, they are being sent to university dormitories as well.
I see. So what is it like to be a patient receiving care at one of these triage centers? In the second video, we meet a patient who tells us.
안녕하세요. 저는 20대 평범한 직장인이고요. 얼마 전 4월 3일에 코로나19의 확진 판정을 받고 17일 만에 완치를 하였습니다.
방문 앞에 배부되었습니다. 장미름은 지금 즉시 들고 들어가시고 해바라기 룸은 1분 후에 도시락을 들고 들어가시기 바랍니다.
제가 센터로 이동하고 나서는 제가 스스로 측정을 했고 간호사 선생님과 의사 선생님과는 면담을 하지 않고 영상통화로 이루어졌습니다. 생활치료센터에서는 병원에서와 똑같은 방법으로 혈압과 체온 측정하는 것, 코로나 바이러스 검사를 할 때에는 가래와 코, 입 안에 있는 물질로 검사를 했습니다. 필요에 따라서는 엑스레이 검사와 피 검사를 하는 사람도 있다고 들었어요. 근데 저는 해당이 되지 않았습니다. 방금 결과가 나왔는데 코, 목, 가래 검사 결과가 다 음성이 나와서 오늘 또 검사를 한다고 하네요. 제가 검사를 받는 시점으로부터 검사 비용, 치료 비용, 입원 비용, 이동 비용, 식비까지 모두 지원을 해주시고 자가격리가 필요한 저희 가족들까지 식량, 생활 필수품까지 전부 다 지원을 해주셨습니다. 세계 모든 사람들이 다 코로나 완치가 되었으면 좋겠고 서로 힘을 합쳐서 코로나 바이러스를 이겨냈으면 좋겠습니다. 감사합니다.
Dr. Yu, I understand Suncheonyang University Hospital also provided its own assistance to the Triage Center initiative. Do tell us a bit more about that.
Yeah. Not only Suncheonyang, Seoul National University, Gyeongbuk National University Hospital who took, which is the Triage Center is close by our hospital. We took in the Cheonan area, we learn of the patients who are mildly ill. Is our medical center, Suncheonyang Medical Center, send the volunteer first and the specialists who take care. But there are a little difficulty because actually we are sacrifice the specialists to stand there because we are give up to our opportunity to have the profits. But we send the special equipped team to there. But anyway, we are welcome. I believe not only Suncheonyang, the others, the high level of the medical facility they sent because Korean government distributed. So like Seoul National University took some area and there are specialists to take care of the all of the system. From the beginning, we are trying to make the kind of unified manuals. Now we set up all, and then we are making it unified or the same way what we saw this video. We provide every 3 days the testing and the same way of the interviewing. And also not only over the interviewing, we make them to be live for the mental consultation we are provided.
I see. Now, these triage centers are poised to close doors tomorrow. What are your thoughts on that?
Well, so I'm glad because we are back to our job as like the medical professional. But I'm so proud about that because we build up this program and we make the manual. I believe the Korean government, we are ready to share our experience and the manual to translate in their own languages. And also I believe we can be modified and some specialists from there. Actually, these days, Korean government and the KOICA, Korean Overseas International Agency, they are the work on in the ODA, Official Development Assistance way. We are ready to. Actually, I'm from the KOICA before came to the Suncheonyang. So we are ready to translate it and make the video how we are protected for as a medical professional and how to help them to understand the people who are catch the positive, the COVID-19. Right. But anyway, I'm very glad that tomorrow will be closed.
Right. Raphael, quite a number of countries are looking to ease travel restrictions on those flying in from Korea. I understand this is also the case with the UK.
I mean, before we talk about the UK, I'd like to talk about the world, actually. According to the World Tourism Organization, 100% of destinations worldwide have COVID-19 related travel restrictions. And as of April 20th, no destination has lifted these travel restrictions. If we look, say, at the EU, all foreign nationals or all foreign arrivals who come into the EU are not allowed to, or they're not allowed to enter unless they have residency or citizenship. And in the UK, there are quarantine requirements for anyone who has visited Daegu or Cheongdo, so if they've come to Korea. But in terms of easing travel restrictions, I think it's still early days to tell whether or not we can ease travel restrictions. In my opinion, we will probably see easing of travel restrictions in an in a phased approach and maybe among countries where you have no new confirmed cases for a certain amount of time. So it could be between Asian countries. I'm not too sure. Actually, I would like to ask Dr. Yu, what do you think about easing travel restrictions in the short term or long term?
Well, this is one of good point. Actually, I'm the doctor, work for the COICA, so oversees the international cooperation. I really want to go to Cambodia and Mongolia soon for Korean government project. The issue is, I will go there, 2 weeks quarantines, and the work few days. I'm back to Korea. I have to be 2 weeks of self quarantines. 1 month, it's gone. So, which means this is restriction of the traveling in the world. We have to open the gates same time together. The problem is character of the COVID-19, it's this virus. It loves very dry and cold temperature usually. So South Hemisphere is now entering the winter seasons, and the people are suffering from the COVID-19 these days. So which means we open the half window only one way, like the North Hemisphere, but we believe we can be safe. But it's impossible because South Hemisphere can transmit COVID-19 again. So we're waiting for till the complete 1 year, in my personal opinion, according to the many specialists and also many the journals from as medicine. And at the same time, we have to discuss it one way, the quarantine way. 2 weeks could be necessary, but if we do the 2 weeks, who want to the London to the Big Eye? So one day the Big Eye to take the pictures back to Korea for 15 days to stay in London. So it doesn't make sense. So probably we need a kind of agreements of the world. That's why WHO will be the move on about this agreement to suggest the people, and we can save the flight. So sorry to say, probably we need the 1 year complete. We can discuss about 2021 early of January or February.
I see.
In my personal opinion.
Staying with the easing of restrictions, we have a long holiday coming up. We're starting from tomorrow. We have Buddha's birthday, then we have the weekend, May Day, of course, before the weekend, and then we also have Children's Day next Tuesday. Do you suppose the eased social distancing campaign here in Korea was implemented a little bit too early? Perhaps it should have come after this golden holiday. What are your thoughts?
Well, Korean governments, there are no way to open from the high level of strong social distance to now easier, because a couple of days before the announcing from Korean government's easy social distancing, we already did to easy social distancing. And I have 3 children. My youngest one now going to the primary school, but still not yet, just the age is like the primary school. She's jumping around and the boring and the scratching in the floor. So she's screaming, but we cannot hold her. So then time to leave, but we have to take care about it. Why? Because still, silent transmitter, younger people and the school boys and girls, they can catch it COVID-19, but no symptom at all, asymptomatics. It can be our super transmitters to any circumstance. So these golden weeks, if we live in 2019, as a father, I have to be in the battle to click to make the reservation of hotel in the lines. But now a little easy because no way to go. But anyway, this holiday, as medical professional, I highly recommend you can enjoy it, this long golden weeks and holiday as families, as within your cities. No more the passing the border and the province and the city. As if you reserve already, enjoy it, but put the mask and limited your activity and keeping the social distance at least 1 meter for each person, and keep washing your hands.
Right. Raphael, what are your thoughts on the eased social distancing campaign here in Korea?
I understand people's frustrations, especially after so long from being told by the authorities to maintain social distancing. And it's very tempting to not wear a mask or be a bit more relaxed, especially since, as we saw earlier on, today we've had 9 confirmed cases, of which 4 were domestic cases. So when you look at the numbers, they of course look very small. And I think it's tempting to think that you won't catch the virus. But the fact that we have 4 infections, these are tested, these are cases that have been tested. there are also the many other cases that haven't been tested or that we do not know of, meaning the virus is still out there. So, you know, I think it is up to all of us to maintain a certain sense of responsibility. And of course, we can enjoy ourselves during this golden week, but we should also maintain strict hygiene and social distancing. The fact that I think it was over the weekend in Busan, a young teenager from Daegu had gone to a nightclub in Busan where there were about 400 or 500 attendees. This just highlights why we should continue to maintain strict social distancing, because we do not know if and when another outbreak could happen. And as I understand, as of yesterday, I believe, authorities are still trying to track down about 80 or 87 people who they cannot get hold of who were at that nightclub, because they took the register, but they put, I think it was fake phone numbers maybe. So
that's one of the unfortunate realities, of course.
It will always be there, and the danger still exists.
What are your thoughts on this, Dr. Wu? What would you give as an advice perhaps to our younger adults?
Well, so young people has hot blood, so
Yes.
cannot be controlled. So because when I was young, I never listened to my parents' words. But anyway, this is, I like to say the young adult, the young people you are not exceptions. Because I had a person of WHO comment already. Sometimes it's cytokine storm can destroy all your organs. Even you are very rare cases, but you can be one of the victims. So also, your lovely and precious, your grandparents can be contagious from you. So please take care. So lifelong, your young blood can be the pumpings later, not only these times. So please avoid the crowded area and the undercovers. So you should be enjoy the time in the clubs later, but a couple not too far. Let me say middle of May, government will announce in the different way, and you can go there. But these days, if you really want to go, what Lapel said, please writing and note through the contact numbers and your name, purpose of the visit, and your open can be the tracing from our specialist. So you can enjoy it, but please don't forget, COVID-19 still is ongoing streak in another side of the world, because people are suffering, because we are all the brotherhood, like Peruvian people are still suffering but another world, but we are kind of the global citizens. We're living all together in the earth, in the small town. Please be going with them.
Right. So if we had a choice between outdoor activities and indoor, you would recommend outdoor activities then?
So outdoor activities, there are, because Korea is a very small land, like the Wonderland, one of Wonderland, there, on the queue, the place. But that time that I got it so impressed and noticed from the Finland, they're waiting for the bus, 1 meters each person, because they want to take care of private to each other. But actually, the Korea is very crowded and small land. It's impossible. So, usually the Children's Day crowded in some Wonderland. But this time, let me suggest younger people outdoor activity is please enjoy the Korean landscape, not on the outdoor the facilities.
Right. All right, Dr. Yu and Raphael, thank you very much for your thoughts today.
Thank you.
안녕하세요. 좋은 아침입니다. 오늘도 청아한 새들의 노랫소리와 함께 수다수다 방송을 시작하겠습니다. 누가 행복해서 웃는 게 아니라 웃어서 행복한 거라길래
금년까지 기분이 안 좋았는데
방송을 하러 가는 시간입니다.
네. 이렇게 응원 메시지 보내주시면 저희가 읽어드립니다. 많이 공감해 주시고 또 좋아해 주셔서 무료한 이런 생활치료센터의 삶에 조금 위로가 되고 즐거움이 되었다는 이야기들을 많이 해주셨습니다.
Right, and that is all the time we have for today. Tomorrow, that is Thursday, is a public holiday here in this part of the world, commemorating Buddha's birthday. So we'll be back on Friday, that is International Workers' Day, with a look at the impact of COVID-19 on the global labour market. In the meantime, Arirang TV welcomes your feedback through our social media accounts or our homepage, arirang.com. Goodbye for now.